In India, the pandemic continues to worsen, with more than 200,000 deaths officially confirmed. On average in the past week, more than 340,000 cases of coronavirus have been reported each day. That's an infection rate which is more than 20 times higher than 2 months ago. As for deaths, the official count is an average of more than 2,600 people a day over the past week. But for both infections and deaths, the numbers are thought to be significantly underestimated. Across the country, hospitals are continuing to struggle with a shortage of oxygen and beds. As our correspondent Yogita Limai reports from Delhi, there are some upsetting images in Yogita's report.
Years of training, but nothing could have prepared them for this. Manjusha Matthew, a nurse and the mother of 3 young children. Every few minutes, there's a new patient. She's constantly scanning how others are holding up. Treating as many as they can. People say, "Sister, please save our loved one." They call us God. That makes us so emotional because we can only do so much.
Even हम भी emotional हो जाते हैं.
We've been following her all week. It's been relentless. I tried so hard to revive this man, she told us, but I couldn't. With resources so short, they're having to choose who they might save. Decisions they should never have had to make. At times we break down. Some nights I wake up crying, but I also feel a sense of satisfaction that I'm doing something to help. This is a hospital in a big city, better off than most others. Weeks of toil lie ahead in a city that's overrun. Everything needed to fight COVID is in short supply.
Every morning in India, we're waking up to news that someone we know has died. Through the day, there are frantic pleas for oxygen, hospital beds, medicines, on the phone, online, even on the streets. And amidst all of that, we're also seeing people who wake up every morning, put on their protective gear, and get down to business, trying to help as many people as they can.
Sarabjit Singh Ghai is a volunteer trying to provide oxygen to critical patients. They should be in intensive care. Desperation has brought them here. Sarabjit offers a temporary reprieve, keeping people alive till they get hospital care. When people's lives hang in the balance, we thought this is one thing we could do to try to save someone, he says. Rati Gadgil has driven her mother here. We're getting nothing from the government, no support. They only come to us when they want a vote. Now, where are they, she says. This man collapsed on his way here. The need is just too great. With each cylinder, they're trying to help as many as they can. Once stabilized, the hunt begins again. Hundreds of people are coming here each day. If we had help from the government, we could do so much more, he says. 10 days since Delhi lockdown, people wait by the side of a road for oxygen. This is India's capital city. Yogita Limai, BBC News, Delhi.
Well, that was the report that Yogita filed just a short while ago, but we're now able to join her live in Delhi tonight. Yogita, let's talk about the concept of accountability here for all of the problems and all of the tragedies that we saw there in the report. What is the notion of political accountability?
Well, I think you've got to look at the circumstances that resulted in India finding itself in this position. In February, you had the ruling BJP party virtually declare victory over the pandemic under the leadership of Prime Minister Narendra Modi. In early March, when you had surges being reported from some districts in India, you had the health minister Harshvardhan say that that the coronavirus pandemic was in its end game in India. The government allowed mass gatherings for religious festivals, for political rallies, till as recently as a week ago. And with that messaging coming from the top, you saw people on the ground becoming complacent as well, not following COVID protocols. Even though in India, we could see that there were the second wave of COVID-19 was more deadly in many parts of the world. Basic things like stocking up on oxygen supplies, stocking up on medicines, ramping up medical facilities was not done. In fact, during the first wave, there were some field hospitals that were built up. Those were actually dismantled. And so now India finds itself in this position where it is trying to rush in oxygen to places where there is a shortage. There is aid coming in from other parts of the world. But this crisis is unfolding on the ground at such a rapid speed that this help is not getting to people in time. There are people dying today who could have been saved if they had oxygen in time, if they had a hospital bed in time.
Yogita, many thanks once again. Yogita Limai there, our correspondent in Delhi. Let's stay with India because COVID cases there have been rising steeply, as we know, over the past few weeks. And with that increase has come the inevitable increase in deaths. And our science correspondent, Rebecca Morel, has been looking at what's behind this surge and what it could mean, indeed, for the rest of the world.
The death toll keeps on rising as India struggles to cope with its COVID crisis. But how did they get to this point? And are variants behind the surge in cases? Since April, India has reported 5 million COVID infections. Each day is bringing record numbers. But are changes to the virus causing this explosive growth or people's behaviour?
It's always a combination of things. The increase in social mixing that's happened over the last several months, the sort of dropping of the guard of people thinking that they can go back to being normal, as well as the potentially the variants that have emerged.
So how is the virus mutating? And what do we know about the variants?
The picture is different in different parts of the country. In Delhi and Punjab, the UK variant is dominant. It has a mutation to the spike of the virus that allows it to enter cells more easily, so it can infect more people. But in Maharashtra and West Bengal, a new Indian variant has emerged. It has 2 key mutations. Lab studies suggest it's slightly more infectious, but less so than the UK variant. But the changes may mean that antibodies find it harder to block the virus. But scientists need to assess how much immunity is lost.
It probably means the virus is a bit less well able to be neutralized by vaccines, but certainly I don't think there's any evidence that it's an escape mutation or that it fundamentally can't be stopped by the vaccines. And I think we have to obviously watch carefully, but there's at present no reason to panic about it.
So is this only affecting India? What does it mean for the rest of the world? The priority now is to get medical care to the sickest, but there's also an urgent need to reduce transmission, because if the virus is out of control in one country, it's likely to spread to others. And these are ideal conditions for the virus to evolve.
The way to limit viral variants emerging in the first place is to prevent the virus replicating in us. That's when they get the chance to have for the mutation to arise. So the best way to control variants is actually to control the global amount of disease that we have at the moment.
Globally, the pandemic shows no sign of easing. The World Health Organization says vaccines are vital, but until they're available everywhere, this is a bleak reminder that no one is safe until we're all safe. Rebecca Morel, BBC News.